and that is your mental health legislation. Elements of your measure were included in the 21st Century Cures Act last December. How did you initially decide to team up on this?
Chris was great. I'll just tell you that I had worked with Tim Murphy on the House side, and Chris approached me and just said, can we work on this together? And we didn't know each other that well, but our staffs worked together fantastic, and I just want to hats off to my colleague and to Tim, who's had some unfortunate events. We got something really significant through. And it shows that we can work on a bipartisan basis, and again, I thank my colleague.
Yeah, you know, listen, it's funny, it may not seem like this, but Bill and I are very good friends, and our families are, and our families are friends, and we became friends.
He's going to take care of my poodle for a little bit, you know, for 2 weeks.
and we have big disagreements on some of these big top line issues with respect to how you work the American healthcare system, but that hasn't stopped us from finding the places where we agree. And the fact of the matter is, you know, we have left millions of Americans behind who have mental illness and addiction by, you know, building a system that just doesn't meet their needs. And so we put together a big piece of legislation, the most comprehensive rewrite of the nation's mental health laws in a long time, requiring insurance companies to cover more of this stuff, putting more emphasis on both prevention and on crisis intervention by setting up a new assistant secretary position that for the first time will be in the Secretary's office with a voice on addiction and on mental health. And, you know, while we still haven't implemented all the pieces of our legislation nor funded it, we're pretty proud to have gotten a lot of Republican and Democratic support. And it's a reminder that if you can set aside some of the most politically explosive issues on healthcare, you can still find agreement.
I'll also say it gave a paradigm, because I've approached, again, Democratic colleagues on committees and say, listen, what about drug cost? You know, Chris and I combined on mental health, and we said, okay, there's some things that we can't agree upon, but a whole lot we can. If we can focus there, maybe we can do something. And so we're working on drug costs, for example. What can we agree upon in this space? We can absolutely get stuff done together.